Everyone, welcome to the Annie Practice Forum September webinar. We moved the meeting up just by a week because we had some scheduling conflicts, but we'll be back on our regular meeting schedule next month. But we're very excited for this forum meeting. We have an amazing guest speaker here with us. Thank you, Liz, for connecting us. Liz is one of the Practice Forum co-chairs. And I'm just going to go ahead and introduce her, and then I'll turn it over to Alex to give us her presentation. So I'm thrilled to introduce Alex Chapman, who is the Director of Regulatory Affairs for Stericycle, with 20 years of experience working with healthcare, commercial, and government organizations. Her work has included developing, managing, and supporting programs that drive and support regulatory compliance and sustainability. While she has worked in a number of roles and industries, Alex's work has been primarily been in complex regulated environments with a focus on healthcare, collaborating with generators, suppliers, industry organizations, and regulators to assess, design, enable, and enhance compliant and sustainable waste management processes and programs throughout the value chain. Alex is the Membership and Special Projects Director for the Healthcare Waste Institute, co-chair of the Stericycle Green Team, and a program lead for WM's Women Empowerment Network ERG. Alex is driven to help individuals and organizations to reach their goals and create safe and sustainable environments for themselves, their employees, and the communities they serve. So with that, I'll turn it over to you, Alex.
Thanks, Kara, and thanks for having me today. I will go ahead and share my screen, and I would like to encourage folks to feel free to use the chat, or if you want to make a comment, feel free. But I believe you should be able to see my screen here. Make sure. Are you able to see the slides?
Yes, Alex, it's fine.
Perfect, thank you. All right, so waste is often thought of as the opportunity at the end of the line, thinking like waste segregation at the time of disposal or waste segregation at the time of final disposition. Opportunities with that, maybe can I take waste out of one waste stream and move it to a less hazardous waste stream, for example. But opportunities with waste really start much earlier. And I think a way to think about this is waste is in everything. It's pervasive, and it can be found upstream and downstream in the value chain, and not just in materials. When we consider that waste can be more than just materials and in process, and understand the full scope of waste and what it can be and what it is, waste management programs really can be used to tell the story of where you and your organization is on its journey, where you want to go, your commitment to your organization's strategic plan when it comes to sustainability and operations, as well as your commitment to your community, compliance, and sustainability elements that ultimately support your business or your health system's viability. Another way to think about this is, let me ask you all, how many of you have had challenges with waste? And this could be a problem that's been identified during rounds, or maybe a survey, maybe an inspection. Have any of you ever had issues with waste? You can use the chat if you want, or an emoji. All right. I see at least one of you have. If any of you have gotten away without having any issues with waste, I would love to know your secrets, because it typically is pretty difficult to achieve. And the reason for this is typically there's a breakdown in your organization's story. And what I mean by that is there is probably a missing stakeholder who wasn't available to provide information on requirements, or maybe a missing resource because leadership wasn't aware of the value that it could bring and the necessity, or maybe just missing information. But the same things that help support a compliance program really are going to be what drives your sustainability programs as well. And that's going to be information and stakeholders. Telling your story effectively takes understanding all parts of the plan to get to the next chapter, and understanding your baseline and your why. What I guess really I'm trying to say is thinking about what are you trying to accomplish? What's your baseline? Where are you trying to go? What are the most important levers? And when you think about your specific world, I guess my question to you is, what is the most important thing to you and your organization when we think about these three things: compliance, cost, and sustainability? And I want to preface this with there's really no right or wrong answer. It's actually pretty tough question. And it's not easy. I'd like you to think about this throughout the session. We'll come back to it. I'm going to walk through an example, and I'll start with an example founded in regulatory agencies, just to help level set us. So typically, when we think about waste and we think about regulatory agencies, what we do is governed by a set of rules. And those rules exist to help keep order and help us achieve what should be universally shared objectives. If we take a look at the federal agencies that are shown on the screen here, you'll see that there's an association throughout all of them. And those requirements are founded in protection. So you can see with the EPA, there's protection with the environment, protection with EPA, protection for employee health and safety with OSHA. And then when we look at DOT, or Department of Transportation, there's also protection in transportation for hazardous materials in commerce. When you all think about requirements, what do you think about when you think about waste? So obviously we've got regulations. Are there any other requirements that you need to keep in mind?
I was thinking of infection control.
Okay, infection control, definitely. All right, well, we can use that one. So that's one of that fits in nicely actually with one of the 4 areas. When we're thinking about waste, there are going to be requirements that really drive your organization's operations. And I like to think about requirements as an operating framework. They're the operating framework are basically defining the requirements that you need to operate within for your organization. And those are going to include regulatory requirements, industry standards, such as infection control, could be accreditation as well. Your suppliers' requirements, because they might have requirements or regulatory requirements that they're beholden to that your organization is not. And then your organization might have additional requirements for its business to ensure that your employees are safe, or that you achieve certain things that are tied to your values or mission or operational objectives, your strategic plans that go above and beyond regulatory or industry guidelines. Now, working within these frameworks can be pretty complicated because of overlapping requirements, and sometimes they don't line up. So it's really important to keep in mind that having an open dialogue with the different stakeholders that cross into these different areas will help you with achieving a more cohesive story, like I mentioned before. So before we get into that, I just want to make sure that we're all on the same page with the why. And when we think, you'll see on the slide some examples. When we look at these examples, you'll see some different ones lined out. Regulations, I have a couple of examples. So there's regulatory requirements with regulated medical waste or hazardous waste. You might be familiar with the sewer ban that the EPA had put out for flushing of hazardous waste pharmaceuticals a few years ago. Then for industry standards, there's accreditation, which are not necessarily regulatory requirements. They may be founded in regulatory requirements, but they are not a regulation that you might be cited for. Could impact other things, though, that would impact your operations. Then supplier requirements, as I mentioned before. So there might be other aspects there that are specific to your suppliers, and then your own organizational policies, business requirements, or like Liz mentioned before, infection prevention. Now, these requirements all have similar tenets and have areas in common. And we look at the requirements, you'll see some common themes. What does your business need, your health system need? You're looking to reduce risk, improve quality of care and practice, safety, driving efficiencies, and having industry alignment, as well as sustainability. And now the term sustainability is not necessarily a regulatory definition or term when it comes to managing waste. It is embedded in process and found in industry standards like the Sustainable Healthcare Certification standards from the Joint Commission. That said, though, probably like a year or so ago, I was talking with a retired systems CEO who talked about the top 10 areas of concern for healthcare executives. And he had talked about how none of those top 10 requirements have really anything to do with waste. They don't specifically call out waste, that is. But that said, while he is correct with that, there are not a ton of case studies out there that tie waste into those top 10 areas. They are interwoven, and it is still difficult to directly quantify exactly how waste directly impacts patient population health, how it ties into workforce, which is a top concern, but healthcare does obviously recognize that correlation, which is, I guess, firstly, why you're here, and then why we also see an increasing focus, such as with the Joint Commission. We could spend like a whole session talking about the concepts that are on this slide, and don't worry, we're going to get into the nitty-gritty with waste shortly. But the example on the top here is a potential one of many that shows the relationship between process, compliance, and sustainability. If we start upstream to the material design and then the product design, and then extract the resources from the earth as shown here to create the products, overconsumption and production without adequate controls, which can be sorted by compliance, whether regulatory or business, really can lead to downstream impacts that adversely impact human health, environmental health, and economic health. And a more tangible way to look at this is if we think about packaging. So excess packaging with no means of circularity at end of life. I know Blue Wrap is an easy one when we think about materials and waste and packaging. Or if we think about something a little bit more complicated, auto injectors. So auto injectors have a few different hazards associated. You have a needle to deliver the medication. The medication's another product. And then you also have a lithium ion battery typically, which is a hazardous waste at disposal. So you have something potentially infectious, something that is hazardous, and something that could be, depending on what that medication is, that is hazardous as well. This can create additional process requirements that increase emissions at end of life, let alone in creation of the product. I'm oversimplifying a little bit because if you think about home health care, auto injectors are probably less environmentally impactful than sending out a clinician to someone's house to do an infusion. However, in a healthcare setting, is that really necessary, or do we need that lithium ion battery? I've had some really interesting conversations with different health systems on this point, evaluating product and material choices by manufacturers that ultimately impact your work downstream and can add cost and additional process. So this is all to say that your organization has a lot of decisions to make. You may choose to overclassify certain waste streams for ease, although it might add cost and environmental impact. I mentioned cost. Does anyone know how much more it is to dispose of regulated medical waste versus municipal solid waste or trash? You can take a guess.
More.
What was that, Debbie?
I was going to say twice, 3 times as much.
Keep going.
Oh, 10 times as much?
It's about 7 to 10 times as much on average. So there's different ways of managing medical waste. So depending on the way you're managing it, it can vary a little bit. That could be whether or not you're purchasing disposable containers, if your waste is being autoclaved, if your waste is being incinerated. There's thoughts about treating waste on site and that having less cost, but you still have to get the equipment and run it and the energy and all involved. So regardless, it's a pretty expensive endeavor. And there's a lot of different, I'll say, things going on in the United States where we're seeing an increase in inspections. Certain states are more active than others. And some health systems are taking a position of just overclassifying waste to not worry about having a citation down the line. Just easier to throw it all into the hazardous waste or the regulated medical waste. But those decisions can directly tie into resource consumption and drive up emissions and ultimately impact climate, which will have a negative impact on community health. And we can spend a bit more time talking about this in a lot more detail, but We'll have to do that another time just so we can focus on the waste, but it's all linked together. So when we think about compliance, compliance helps create controls and support sustainable outcomes and use of resources to meet the needs of today without jeopardizing future resources. So finding a balance. We want to protect human health, environmental health, and fiscal health. And that compliance overlap, remember we talked about at the beginning with the EPA and OSHA and DOT, it's all about protection of those same tenets. So in order to have a sustainable program, you need to be compliant first. That question I asked at the beginning, what's most important, compliance, sustainability, or cost? Again, not an easy question because they all kind of interconnect. Let's think though about how to apply these concepts to waste. So I mentioned before about waste being pervasive throughout the value chain, upstream and downstream, and from product design to disposal. And it's not just tangibles, it could include resources like time. And in order to reduce waste, we really need to understand the full scope of the situation. And we need to go back to that concept of telling a story, your organization telling a story with the materials, the processes, the people involved. And in order to tell a good story, you need to be able to articulate details. Some of you I had mentioned, I think, Liz, I know you had raised your hand before and said who's had issues with waste. Maybe it could have been an internal audit. It could have been a visit from the state, right? It could be any number of things. When you've had challenges with waste, what have typically been the types of challenges that you've had? Does anyone want to share? Maybe with reporting, maybe improper segregation.
I know from our end, it's a proper segregation awareness. And the buy-in, because people are used to certain things, and so it's change of practice.
That is common for sure. It's sometimes too, not only is there that change management element, which is a big component, you need additional resources to support that change and repeat the change and the needs and process change as well, and training. Usually these kinds of gaps are caused because there's a break in the story. And again, that could be missing a resource or not getting the support that's needed because there's a gap in leadership understanding, or it could be, a gap in capital, right? You might just not have the funding to make that happen. You have to make changes in your process to adjust for that. So when we think about what's missing to tell the story and make these things happen, we're thinking about data, and data isn't just volumes or emissions factors, it's a lot more. And in order to be able to articulate the type of data that we need all hands on deck. And that means typically identifying the correct stakeholders. When you think about waste programs and working with the right stakeholders, obviously this group is probably all clinicians. Who else do you need to work with when you're working on a waste program? Who are other stakeholders?
Like our facilities management.
Sure.
Like a waste management within our facilities.
Mm-hmm.
Definitely the EVS team and infection control.
Absolutely. So those are definitely stakeholders that you want to engage. There's support services, which would also include safety. That could include transport, that could include the facilities folks, your clinical teams. Purchase services are a really important component because they are going to be the ones that should be working with the other stakeholders to determine the appropriate products to purchase and consider what happens to the materials at end of life, make sure that there's good contract language and standards of work, KPIs that help drive shared accountability. And then one thing that I think is often overlooked when we think about who do I need to work with to make sure my program is successful is not just who's in your organization, but also who you can partner with external to your organization. And that could include other peer organizations, industry groups, regulators, suppliers, and GPOs. The peer groups or peer hospitals or other healthcare facilities, this one I've gotten some interesting comments over the years. where I actually had a president of a decent sized hospital say to me, I don't know if I want to do that because I want to be the best in this marketplace at these initiatives, but you can't get there by yourself. It's you got to work together. It's think of like rising tide lifts all boats, right? We're all after the same thing in our own ways. And yes, you're after market share among other things, but there are certain areas where shared information can be very valuable. When we're thinking about stakeholder engagement, if you don't have the right people involved, then it's going to likely lead to a misunderstanding in what the requirements are and what you need to successfully build your program. And that can go all the way through from the time materials come into your house, all the way through process management to disposal and missegregation, things that could happen in your processes, to what happens when it leaves your facility. So when we talk about stakeholder engagement too, it's not just the folks who write the policies and do the training and are making decisions on what those programs should be. Your stakeholders are also your frontline team members as well, because they're going to be the ones doing the work and can give you real-time feedback as to what's working and what isn't, and where ways that things could be improved. So just important to keep that in mind. And we don't have time to get into the weeds with the overall process today. We're going to focus on one component of it. However, I want to show this to you to clarify in order to understand where you are today and the how and the why, and determine where you want to feasibly go and how, basically in writing the story for your organization. How you'll measure it and maintain it is process driven. And like a good story requires the author to identify the who, the where you are today, where you're going to go, how you're going to get there, how you're going to measure success. So if we take a look at this, once you have the stakeholders identified, you're going to then be able to better clarify the capital that you have to work with. And capital isn't just money. There's any kind of resource available. Then you're going to consider, what are the requirements that I need to operate within? So what are those 4 requirement areas again? Regulations, your industry standards and best practices, your supplier requirements, as well as your organization requirements. Your community may also help drive some of that as well. From there, you'll be able to start shaping your strategy to achieve your goals, and you'll be able to use different aspects to shape that and put that together. And once you have that, you'll be able to build out your program plan and implement it. You'll start it, you'll maintain it, and then in order to ensure that it's working the way that you need it to, you're going to have processes in place to measure, reinforce, and reevaluate and make adjustments as necessary. There's a lot within this. Again, don't have time to get into it today, but if you ever want to learn more about it, I do have some additional resources that I can share with you, and happy to talk through it with you. But for today, we're going to focus on the operating framework. I keep coming back to requirements in my examples because that's where we're going to stay focused. It's really a key piece of information that's going to help shape your story. Without understanding the operating framework, which are the requirements your organization needs to operate within, it's not really going to be possible to successfully execute a strategy to manage resources appropriately long-term. Without understanding the importance of and including a sound operating framework into your program plans, you're not going to really have the possibility to improve environmental, social, and economic or financial outcomes for your organization, or really positively impact anything larger scope. I'm sure some of you might say, yeah, that's really great, but there are so many regulations, there's so many industry standards, there's all of these suppliers I work with, and my organization alone has a lot of policies as well. How on earth am I supposed to know all of the rules and requirements when it comes to waste, especially because there's so many different types of waste in a healthcare facility? And depending on where your organization is based, you might not just have state and federal, you might also have local or county requirements, tribal requirements. So what we're going to do is we're going to take a step back to the very beginning with waste generation. And when you think about waste in your facility, I want you to think, before I ask you about challenges as a whole with waste programs, but as a clinician, what are some challenges that you specifically face when it comes to waste and managing waste? What comes to mind for you?
I'm a clinician, but I'm also an educator. So I have like I'm thinking of our simulation lab. I'm the director of our sim lab. And the volume of plastic single-use products and that creates waste, and then where, like right now, there's a limited recycling that's involved in those plastics. So kind of having the knowledge of what we can recycle, and then seeing ways that we can limit the amount of products without impacting the students' ability to practice and development. It's one of my challenges.
Yeah, plastics, medical plastics, thanks, Gina, are definitely a tricky one, especially because not only do you have to find out if your hauler and end facility is able to take them, there's also going to be waste acceptance policies that may evaluate really if something's potentially infectious or perception thereof. There was an organization where I worked with where their landfill had new management come in earlier this year. I was talking with them, and the management of the landfill didn't understand or know healthcare. So their perception was anything that came out of a healthcare facility was potentially infectious. I'm talking out of dietary, like it didn't matter. So now I want you to think about medical plastics and like just having that conversation. When I talked about before, having conversations with all stakeholders, this is why it's really important to have those conversations and understand when we look at supplier requirements, for example, at disposal, what they have outlined and why. And sometimes it's just a misunderstanding. There's that ick factor. So firstly, it has to be material that they can take, and then they need to understand what it is so they feel safe, because they want their employees to be safe as well. It's a good example though, for sure. And I saw that someone else had put in not having proper bins available, and it's difficult to sort. And more additional information on the supplies. With the supplies too, there's a big opportunity with that. We'll talk a little bit about that more later. I appreciate the feedback though. One way, and this might feel kind of oversimplistic. I think the first place to start always is, what is my organization's policy? Because again, your policy should take into account what the regulations are, what the industry standards are, accreditation requirements that you need to follow, your supplier requirements, as well as your own business requirements. And then considering, starting at the very beginning, what am I throwing away? So what is this material? Is it used? Is it contaminated? Is it something that's reusable? And then from there, what type of waste is this? And you do a waste determination. Basically, with the waste determination, you've got what is the waste, how is it generated, and typically who generated it and where can also impact that. But, for example, I might have like a urine specimen cup. What am I throwing away? I've got urine, I've got a specimen cup. There's probably going to be patient health and protected health information on here. So there's a lot of things that go into making a determination on where you're going to throw it away. And that's where you get to, what are the rules? The policy, your policy is really going to be the best way to manage that. And then from there, as you think about process, if you're the ones involved in identifying process, you need to think about, are there bins available? Where am I generating this waste? Who generates the waste? How is it generated? Do I have the right containers available? What's needed? Who's doing the work? And then how am I going to make sure that this is being done appropriately, monitoring it, measuring it, and reevaluating along the way? And when I say examples with the how, there's a lot even within that. So segregation, packaging, collection, documentation, transportation, disposal. So there's a lot of elements, and this is where having a really solid framework to operate within, and having policies, training, having champions identified to help support those processes will help you not only meet the bare minimum requirements, but then look at things like, how do I take this to the next level? Are there things that I could be recycling instead of throwing away into the trash? So what we're going to do now is we're going to go through an example using infectious waste. We're going to apply the operating framework to infectious waste. And I am going to go through some background information on requirements just to level set so we're all on the same page. And then we're going to get into specifics. And I do want to say what we want to focus on too is thinking about your day-to-day. So as you are going through the workflow and process, I'd like you to think about what the requirements, is this how you understood it? What's different? And then we get to examples. Would love to talk through that with you. So I mentioned in the beginning those 4 areas, and I've consolidated them for brevity into 3 here, but there's 4. There's regulations and industry standards. There's industry waste and supplier requirements. There's also your organization and community requirements. We are going to start off with the regulations, and the other requirements can include industry standards to ensure. We're going to review some fundamentals before we get to those examples I mentioned before. To level set, when we're talking about infectious waste, we're going to focus on the primary agencies federally that regulate. So you've got OSHA, DOT, and then there's a bunch of non-federal that can tie into it. With OSHA, OSHA is going to be focused on employee safety. Regulated waste is regulated in the bloodborne pathogen standard. You'll notice that EPA is not on here, and that's because the Environmental Protection Agency had decided many years ago that the bigger risk with regulated medical waste or infectious waste was to employees more than environmental, and they decided that they would let the state EPAs come up with their own requirements. And we'll talk about that on the next slide. But just wanted to point that out because sometimes there's a misunderstanding and folks think that it's regulated by the federal EPA. It's really more OSHA, DOT, and then every state has its own thing. Sometimes though, some states will just adopt federal. With DOT, they look at the safe transport of hazardous materials. Hazardous materials are not necessarily the same things as hazardous waste. So when we talk about potentially infectious, that doesn't mean it's a hazardous waste, which is regulated under the EPA. DOT, though, everything rolls up under them. So it's going to be grouped under what's classified as hazardous materials, and regulated medical waste is included in that category in transportation. So I mentioned before about the state EPAs. There's also some states that have departments of health that weigh in. Those are extra fun when you've got multiple state agencies with their own terminology and definitions and requirements, and then you also have to mix in the federal. And you might say, what am I supposed to do with all of this when there's all these different requirements? What you need to do is follow the most stringent. So whoever's got the most strict rules is the one that you need to follow. Those state requirements typically are going to regulate generation of the waste and how it's collected, stored, and then ultimately transported, treated, and disposed of. And by the way, if you guys have any questions at any point, feel free to drop them in the chat, or you want to come on off of mute, that's fine too. So I mentioned the state requirements. There are a lot, many different definitions, and they might even use different identifiers. So depending on the state that you're in, that you might know medical waste as biohazardous waste or infectious waste or potentially infectious medical waste, biomedical waste. It's not the same across the board. And then if, as I mentioned before, a state is more stringent or strict than the federal, you need to follow the more strict or stringent requirement. There are some different waste categories by state, and those could include waste from patients in isolation, so that's definition in some states, cultures in stock, unused sharps, pathological waste, for example. Some states define trace chemotherapy waste. So it really is going to be on a case-by-case basis. And if your organization crosses multiple states, you then also have to think about, am I going to have my sites in each state follow the state requirements? Or do we create a universal rule across the board where we follow the most stringent? And that's not something that can be done in a vacuum. Obviously, it has to be done really by committee to determine what makes the most sense. Now, I mentioned before OSHA and DOT were the 2 federal requirements. We're really going to look at the 2 of those right now before we get into some examples. And we'll start off with OSHA. And OSHA is regulated medical waste will include liquid or semi-liquid blood or other potentially infectious materials, and we'll get to other potentially infectious materials in just a moment. There's also items that are contaminated that would release blood or other potentially infectious materials in a liquid or semi-liquid state of compressed. So with that second one, would a Band-Aid with a drop of blood meet that definition? What do you think? You can use an emoji or come off of mute or use the chat. So could a Band-Aid release blood in a liquid or semi-liquid state if compressed? And I'm talking a normal, let's say you just had blood drawn and you got a Band-Aid. Probably not. Probably not. I see Kara said no in all caps. Yep, probably not. If someone's Band-Aid is dripping like blood like that, the Band-Aid probably was not the right product to use. So, but the other parts of the definition, items caked with dried blood or other potentially infectious materials, contaminated sharps, and pathological wastes. When we think about this definition too, typically we're going to think of universal precautions associated. Let's take a look at other potentially infectious materials. So in OSHA's definition of regulated medical waste, I mentioned other potentially infectious materials, or OPIM. What are those? Well, basically, according to the CDC concept of what is standard precautions, I'm going to oversimplify here and say blood isn't the only potential risk. It's really going to need to require us to consider other pathogens that might be transmitted in other body fluids other than blood. So the Centers for Disease Control uses a guideline called Standard Precautions for Protection from Bloodborne Pathogens, and those standard precautions recommend treating not just blood, but most other body fluids as well as being potentially infectious. And that term is going to be defined as OSHA as meaning any body fluid that's visibly contaminated with blood, any of the following body fluids, which are listed here. And you can see most of these body fluids are going to be typically around organs inside of a body. I do want to point out also that it's all body fluids in situations where it's difficult to differentiate between them, probably going to be in a more surgical situation. I have a question for you. You know, actually, I think I did leave something out here. It's also going to include unfixed tissue or organs other than intact skin from a human living or dead, and then certain cells, tissues, and organ cultures and culture mediums or other solutions or other items from animals infected with specific pathogens. So that's other potentially infectious materials, super high level. But I do have a question for you all. On this slide, do you see feces or urine on this list? All right, I see Debbie shaking her head no. All right, so she's correct, and Jennifer too. So the CDC says that universal precautions do not apply to feces, nasal secretions, sputum, sweat, tears, urine, or vomitus unless they contain visible blood. So urine and feces are not regulated medical waste unless your state or local government has an additional qualifier. But that said, you have to go back to those 4 requirement areas. Your organization might decide, you know what? I'm going to manage this urine specimen cup as regulated medical waste. And that's fine as long as the lid is closed. It's contained liquids before disposal, but it's not necessary. So we'll come back to body fluids in a little bit. First, though, I want to have us take a look at one other agency when we're thinking about infectious waste, and that's the Department of Transportation. When we consider varying levels of risk, the DOT classifications really has considerations around preparing packaging for transport to ensure safe handling and transport on the roadways, and ability to manage in the event of an issue during transportation to limit impact to human health and the environment. And the DOT includes infectious substances on its hazardous materials table and defines that to mean a material that's known or reasonably expected to contain a pathogen. The DOT further distinguishes pathogens as being category A or category B, And what you really need to know here is category B. There's also regulated medical waste. Category B, regulated medical waste. Those are not in a form that are going to potentially cause permanent disability or death to an individual. Category A, however, is in a form capable of causing permanent disability or life-threatening or fatal disease in otherwise healthy humans. So if we're talking about disposal of materials and patients, we're not talking about propagating certain diseases in laboratories or pathogens in laboratories. We're talking about treating a patient with the Ebola virus or Marburg virus. Those are going to generate category A waste. A patient that's been admitted for a hip replacement and surgery that's otherwise healthy, their waste would be regulated medical waste if there was anything potentially infectious. So this is just another level of things you need to keep in mind when we're thinking about why wastes are classified the way they are. And if you want to know more about the Department of Transportation and how to identify if something's a category A waste, there are resources available. Feel free to reach out to me and I'm happy to send that your way. So we're going to look at one other definition before we get into a section where we're going to talk through some specific items. And that's going to be sharps. And we're going to look at the DOT definition in particular. I want to point out here that the definition not only talks about having the ability to pierce or cut or penetrate through skin or packaging, it also needs to be contaminated with a pathogen or become contaminated with a pathogen through handling or transportation. Now, this gets more complicated depending on the state that you're in. So, for example, New Jersey, in their definitions of what medical waste is, they have a category of unused sharps. And unused sharps, for example, for them would be unused syringes, among a few other items. And there are reasons behind that go back way many years from when sharps had washed up on the shore, most likely, right? That's going to drive that decision where they went a bit above and beyond. Other states, though, the material has to be used. So it's really important to understand what your state requirements are. But you can see here, needles and syringes are included, as well as scalpel blades, glass pipettes, tubes, broken contaminated glass. On here, if you think about a vial, medication vial, something I see often discarded in a sharps container, medication vials, this really are not, and I'm not talking ampules, are not technically going to be a sharp by definition. However, your organization, again, may choose to manage it that way. And it also might be because your trash hauler or the landfill won't accept it either. So again, got to think about all of those different requirements that come into play here. Any questions on any of this before we get into the review? Actually, I see Debbie dropped one. And so where do retractable needle syringes fall? So if there's still a needle, that needle, if it's been used, it's going to be a sharp. If it hasn't been used, it's going to be state dependent on how that state defines it.
I'm just thinking about diabetic patients or people with taking allergy meds or things like that. That's such a challenge for them to have some kind of a container to put their sharps in, and then how do they dispose of them? And they're like, well, they're retractable. The needle doesn't, can't hurt anybody. So that's a question I've heard.
It's, I mean, well, it's like the urine specimen cup with the needle contained, right? There's a needle in here, but if I think about the DOT definition, the needle's contained, right? I can't get to it. So then I have to think about what are the state requirements? What are my supplier requirements? What's allowed to go based off of these other requirement areas? So Debbie, if you wanted to reach out to me after, I can take a look at the state requirements for you and provide you that information if that would be helpful. All right, so time for what is it? So with this, is by definitions that we just covered, is this regulated medical waste or sharp? So in this first one, we have unused cotton swab or gauze. Is this RMW or is it a sharp? So unused cotton swab or gauze. All right, I see we've got regular trash, so it's not RMW or sharps. All right, thanks, Liz. So what about a blood saturated gauze? Debbie, I saw you talk, but you're on mute, so I'm not sure. I see Rebecca's
I said
given us-
RMW.
You got it, right. That's pretty saturated. That's RMW. Now, what about a Foley catheter with urine?
RMW.
All right, so this one technically is not, because remember, urine is not a regulated medical waste. However, your organization may choose to manage it that way. So this is a, what is my policy? What is my waste supplier take, et cetera? What about a syringe with a needle? Sharps, medical waste?
Yeah.
Neither?
Sharps.
Mm-hmm. All right, what about a syringe without a needle, or we've got a saline flush? What do you think? All right, I see we got a response in chat that it's a sharp. So the real answer here is it depends. It depends what state you're in. It depends on how that material was used. Did it become contaminated? Is it potentially infectious? What is your policy? Like, and I know we're looking at definition, but even by definition, it really still depends on the state and how it was used and what it was exposed to. What about empty medication vials? Just talked about this one. Is this by definition regulated medical waste or sharps?
It could break, in terms of.
So technically by definition, and Rebecca's correct and Liz is correct, it's technically neither. So it's, if we're talking about an ampule, again, those where we're breaking the neck off the top, that's going to be a different situation. Or like, think nebulizers, another one, but the vial itself where you actually have to insert the needle and draw the medication out, that is technically not a sharp, but your organization may choose to manage it that way. What about, if we think about from a compliance standpoint, what about management of contaminated linen? So if we think about the regulatory requirements, let's say a patient has blood on their sheets. And contaminated laundry under OSHA means laundry which has been soiled with blood or other potentially infectious materials and may contain sharps. Do you put linen with blood on it into your regulated medical waste today in normal situations? So I think I saw Debbie, you nodded your head yes. Does everyone else put their linen into the regulated medical waste? All right, I see Rebecca says no. So it is not necessary to manage it as a regulated medical waste. It does not need to be managed that way if it's laundered, but it should be managed using universal precautions in line with OSHA regulations and other applicable guidelines. That said, your supplier might have specific requirements around what is acceptable and what is not. And remember, I said there's different levels of infectious substances and such. So if we're dealing with a category A patient, that's a different story. We're talking about medical waste right now. But if the decision is made to discard it, it should be managed as a biohazardous waste. So I saw, what if it's a controlled substance? Gina, if you could clarify if we're talking about a spill on linen or in a vial, that would be helpful. And while you're,
it was back with the vial, with the empty vial.
so if the vial is empty, it's going to depend on what your supplier will take. If it's empty, there's nothing left, so it should be okay. There's certain hazardous waste that might change the classification of empty, like chemo, for example. Or depending on if your state has adopted subpart P, some listed waste might also require additional management, but it's controlled substances should not be an issue. I will say though, for example, in my organization, empty methadone cups we will not take because of the viscosity and like the thickness of the liquid that remains, but in basically anything else, if it's empty, it's empty. So that technically is fine. It's really going to depend on supplier requirements and your organization. Good question. One thing I was asked to cover with you all is around what happens to medical waste. So it's going to typically go through one of two processes. It needs to be treated through a process to kill the pathogens in the waste. So with autoclave, think of it as almost like a pressure cooker in a way. So you're going to have pressure and high heat. And then incineration is going to be the alternative that's going to also destroy the pathogens, and only certain waste streams are better suited to be managed via incineration. And some states might have additional clarifiers, like California requires that certain waste be incinerated. That might go above and beyond what other states might require. And those waste streams that are typically incinerated are going to be pathological waste, trace chemo waste, non-hazardous pharmaceutical waste. There are going to be additional clarifiers where, for example, the organization I work for, Stericycle, we will not autoclave trace chemo waste. That is a full stop, regardless of what the state requirements are, and require it be managed by incineration. So those are the other other components that you need to think about with that. Any questions on waste treatment?
I have a question, and it may not have anything to do with this area at all, but we're hearing more and more in terms of stool, the study of stool for organisms, in particular communicable diseases or things like that. What happened, I mean, I don't know anything about how that's managed. If they pick up a certain number, they'll say, well, this flu is circulating in this area because we've, found so much flu virus in stool. So then what do they do with that? How do they manage that once they have found it?
I just bounced ahead to this section. So let's talk about waste from isolation patients, or to what you're talking about there. And this could be stool, could be body fluids, but we're going to talk about the context of isolation waste, or these kinds of situations that you're discussing. And I get a lot of questions around this type of stuff. Management of isolation waste, like waste from patients with C. diff or COVID or flu, like you said, right? And there are going to be things that your team needs to consider to help guide your decision. So if we use C. diff, for example, I've been asked, well, what about stool from a patient should be for with C. diff? How should that be managed? Should that be managed as RMW? Should I put my gowns that I wore when I was in the room working with the patient in the RMW if it's disposable? Now, if we think back to the definition of regulated medical waste and other potentially infectious materials, feces is not included in that definition. However, like with all wastes, we got to think about those 4 requirement areas, and we need to do, and this is true with every waste, a risk assessment. So what are the risks associated? So question 1 is going to be, are there regulatory requirements for management of C. diff waste generated from a patient? You consider the federal and state requirements for C. diff, and it's not specifically called out. Then you're going to move on to question 2, which is, what are the industry best practices or industry requirements? Are there accreditation requirements that I need to keep in mind? What are the risks associated? You might also turn to other industry standards and say, let me look at the CDC or other sources to make a determination as to whether they feel there's a possibility of transmission that's high enough to manage my disposable items or stool as medical waste. The third question is, do your regulated medical waste, solid waste, or trash, or other haulers have specific policies around this where they won't accept the waste? And then lastly, how does your policy direct management of this kind of waste? So it's not a straight answer. When the requirements were made, they were originally created thinking of specific pathogens like and diseases like HIV, and hepatitis, for example, and then that thought process continued as we all learned, right? It continued to expand. However, it doesn't specifically call these items out. So this is where you need to make a determination as an organization what you feel using science-based information, et cetera. What is the real risk associated with this? So if you were to flush stool down and through the hopper, that's, I mean, I guess that's going to be one method of doing that. But if you're evaluating disposal, maybe it's on a Chuck's pad, you need to go through those processes. So unfortunately, it's not a cut and dry kind of situation. I'm sure you were looking for the, like, this is it. Sorry, I don't have that for you. But it really depends.
It's complicated. I hear it.
It is. It really is. I noticed the time we have just like 5 minutes left or so, and there's a lot that we could talk through still. But Liz, I wanted to take a moment and see if there's anything you wanted to cover in particular in the last few minutes.
Yeah, thank you, Alex. I never thought I'd get so excited about waste streams. I did have one question regarding regulated medical waste in terms of red bag waste. I know it's picked up, it's per pound, right? So how much, what's the cost of, disposing one pound of regulated medical waste versus just regular trash?
It's typically about 7 times more expensive to discard into the medical waste versus the regular trash. And it's not like a clear cut number, because, for example, with the trash, you're going to possibly have per pound, you might have tipping fees or other costs associated. And then with medical waste, depending on a few things, actually, if you're autoclaving or incinerating the waste, the price might vary, like the cost might vary. Additionally, if you're doing a clean out, like a mass clean out of something, there might be some sort of additional cost. But I think a good frame of reference is to think about that 7 to 10 times more expensive for medical waste cost than for regular trash,
Right.
which is pretty significant.
It is.
And as you Liz, I know something that we've talked about before is looking to reduce regulated medical waste. And a way to do this is not only through education and posters and training, but also removing regulated medical waste containers from every patient room. If you think about a general med-surg room, and you think about the types of activity that occur in a standard med-surg room, and what medical waste truly is, do you need to have a container in that space, or can you have a small portable bag that you could take with you to discard in a centralized location, which is called typically a red bag transport system, to reduce that financial impact, that environmental impact? It also helps with efficiencies for the EVS staff that have to go to less rooms, and they can spend more time with patient room turnover. So there's in cleaning, there's just a lot of potential upside. But I've worked with organizations where this has become a major debate because of concerns about what medical waste is and the potential for infection. Liz, I know that, or spread, or vectors really. So Liz, you went through this when you did this initiative. I guess, what did you do? What stakeholders did you engage, and what were the requirements your organization kept in mind to ensure alignment to policies?
Right. Yes, we spent over a year tackling this initiative. Only to say that we have some great success with those holders that we incorporated in every patient room. So it's accessible, but it's not that easily accessible. But we also was very aware of the work stream of these frontline workers. We didn't want to make it any harder for them to go across the hall to dispose these regulated medical waste or to pick up some red bags. So that's why we created these dispensing system within each patient's room, and it's worked out very well. And we've seen a significant decrease in our regulated medical waste. And of course, it's a win-win for the environment and for our finances.
That's fantastic.
And as far as stakeholders, we definitely education. I can't stress enough about the awareness campaigns we had, and we had to get our EVS folks and infection control, and of course all the regulatory affairs of the hospital and risk management to be a part of this initiative?
I think other stakeholders too that folks can keep in mind. So if you're a member of industry associations or groups like Practice Green Health, they might have resources that are available. Reach out to your suppliers. So if you reached out to your Stericycle account rep, or you had questions about how to go about doing this, there are resources that we have as well. Your state might also have additional resources. So there's information out there. And Liz was very successful in getting this implemented at her facility. And it's not easy to do. It takes a lot of coordination and getting everyone on the same page, making sure that folks actually understand what the requirements are associated with it. Obviously, cost reduction is a pretty big driver right now when we think about sustainability, but this is a multi-prong win here. You've got a cost reduction, you have a reduction in waste. You have also, by better understanding the materials that you're throwing away and what is medical waste, you are less likely to make a mistake. Your staff is less likely to make a mistake and put something into the trash that they otherwise might not have had really true awareness around. And Liz talked about using holders for the bags that they have, the small little transport bags that they use. Some organizations will keep those either in the room. If the room is designed to sustain this, there are some organizations that have drawers in the patient room. Sometimes organizations will have them positioned at nursing stations, because if you're going to go in and do something at the bedside where you're going to generate medical waste, you can bring that with you. But in this instance, Liz, as I recall, the thought was we want to make it as easy as possible for nursing so they can grab it and there's no risk of needing to leave the room.
That is right.
So I think, as we wrap this up, in order to drive sustainable outcomes with your programs, you need to have a foundation in compliance. You need to understand what those requirements are in order to be able to develop the program effectively to reach those additional next level goals around sustainability. And again, those requirement areas are going to be regulations, industry standards and best practices, waste supplier requirements, and then your own organizational policies. So as we go back to that question I asked at the beginning, what's most important, cost, compliance, or sustainability? Again, no right answer. And this might be a little rose-colored glasses, but I think sustainability really is the answer, because you can't, if you're going for sustainability, compliance is fundamentally a part of it. You have to have it. And then cost will come with meeting those goals. But cannot underscore enough the importance of compliance to make sure that you're limiting risk and you're protecting human health, environmental health, and your organization. If you have any questions, we do have a team that answers an inbox. It's ask-regulatory@stericycle.com. We also have a customer support number. But if there's other questions you have, or you'd like to talk a little bit more about those waste supplier requirements or any example we talked through today, I'm happy to speak with you or follow up with you directly. Thank you very much for the opportunity to talk with you all today. I hope this was helpful.